Welcome to the Vantage Fit Corporate Wellness Podcast. This podcast is sponsored by Vantage Fit, the all-in-one AI-powered corporate wellness platform developed by Vantage Circle.
Healthcare disruption and preventive medicine intersect at the forefront of transforming the healthcare industry. Disruptive technologies such as artificial intelligence, telemedicine, and data-driven approaches are reshaping how healthcare is delivered and how diseases are prevented. We'll discuss more on this topic in today's podcast. I'm your host, Dipshi, and today I have with me the co-founder of ServeRx, Breck L. Breck L is the co-founder of ServeRx, board member, FOY Wellness, advisory board member of University of California, Irvine. He co-developed the program that is now the largest third-party payer in the country for workers' compensation pharmacy claim, with nearly 20,000 pharmacies in the network covering all 50 states, disrupting the multi-billion-dollar PBM industry in healthcare by removing the PBM middleman, saving self-insured employers and cities millions. Welcome to the show, Breck.
Thank you. It's great to be here.
Amazing. So we are so glad to have you here today, Breck. So thank you so much for giving us your time.
My pleasure.
Okay, great. So before beginning with today's topic, so would you like to throw some light about yourself and also about your wellness journey?
Sure. So I've been in healthcare now for over 20 years. Started back in 2003, helping community pharmacies all over the United States better serve injured workers. Before the program that was a part of, pharmacies were kind of on their own to figure out when an injured worker would walk in and say that they got hurt on the job, and so they needed a prescription, either usually for pain, inflammation, or an antibiotic. That pharmacy would then have to make a bunch of phone calls and figure out if it was a compensable claim, if the accident really happened at work. There was a lot of verification work that had to be done, and then approvals in order to dispense the medication. So it was really quite, a labor for community pharmacies who really didn't have time to do all of that. And so a company was set up called Third Party Solutions to help take away some of that busy legwork that community pharmacies had to do. And so I was a part of that original grandfather industry to help pharmacies better serve those injured workers so they wouldn't have to wait around for, hours or days for approval. They'd be able to get served that same day without any, hassle or delays or out-of-pocket costs to the patient. So it was a wonderful program. Just about every pharmacy in the entire United States signed up to use that. And then a big pharmacy benefit manager, a PBM, saw the opportunity to roll all of that, those patients into their networks. And so it was acquired by a big PBM, a pharmacy benefit manager. And that left a hole in the marketplace here in the United States for a true third party processor. And so some partners and I started the company that we've been operating now for over 10 years called ServeRx. So it's the same program, but with 20-year newer technology and still continuing to help community pharmacies better serve their injured workers. But during the pandemic, with the COVID outbreak all over the world, a lot of businesses closed down for a time, and some of our independent, small pharmacies were having a struggle as well to stay open and stay profitable. That compounded with lower reimbursements from the pharmacy benefit managers, the PBMs, over the years. It was making it really, really hard for these community pharmacies to stay in business. And so, being an advocate for these small businesses and wanting them to survive, I put on my consulting hat and said, how can we help these community pharmacies not just survive during this time, but provide better patient care and better patient services. So many of these independently owned pharmacies serve rural communities, and that community relies on them to be there, to provide prescriptions and other health solutions. And so I had this idea, we should help these community pharmacies become their health hub again for that community and provide more than just a prescription medication. Why shouldn't they also provide, testing services so they could start, doing the COVID testing? And so many of them did start doing the testing, and then that expanded into, respiratory virus testing and other solutions. And so now we have a whole campaign to help these community pharmacies become their health hub again for their community. And if you're familiar with the minute clinic concept that the big chains have, this would be a minute clinic, but on steroids, because of all of the new technology and different solutions that are being provided. One example would be custom medication. Patients, have different genetic makeup. Their DNA is unique, and not every medication works with patients. In fact, 99% of the human population has one variant in their DNA that doesn't allow them to metabolize certain medications. Well, we can now perform pharmacogenomics, or a DNA test, that will identify the genetic makeup of an individual patient and better determine what the right prescription medication is to help that patient get better. And so there's some really amazing things that we're bringing into these community pharmacies to better serve patients and to have more of a concierge personal experience to help patients not only feel better but actually get better. We're using AI, artificial intelligence, in blood analytics, so we can identify markers in a patient's blood to determine what a future disease might happen if corrections aren't made today and the patient doesn't make some changes today in order to avoid getting a disease down the road at some point in time. So yeah, it's an amazing program. We're excited to be a part of it and helping not just our pharmacy partners but the patients they serve.
And as you mentioned about AI, so how is AI being used to advance these preventive healthcare measures and personalized treatment plans?
Yeah, so a patient can, go to the doctor because they're not feeling quite right. They know something is going on, and so it's pretty standard practice to do a blood draw and get their labs done. And once the lab work is done and it comes back, the report comes back to the primary care provider, they can, look at those and most of the time it's in a normal range. And so the doctor tells the patient, yeah, your blood work came back and everything is normal. But what does normal mean from one patient to the next? And so AI is now being introduced into analyzing blood markers, and blood markers can determine where deficiencies are and where future potential diseases may happen if changes aren't made and if deficiencies aren't corrected. And helping the patients better understand that it's more than just the prescription medications, it's also their diet, right? It's what they need to be consuming or not consuming, and helping them make better dietary choices. So, a good example would be deterring diabetes before, a patient has full-blown, diabetes.
And do you think wearable devices and health tracking apps these days play an important role in promoting preventive medicine, and how might they impact healthcare costs?
Yeah, I think there's a lot of great opportunities for wearables, just in helping patients understand that they need to be more active. Number one, the 10,000 steps campaign that you can get on most Fitbit, Apple Watches, any wearable device, is a very simple example of we need to be more active. We need to get up and get moving around. And I think that better than a insurance or healthcare provider providing a reimbursement to someone for a gym membership, they don't have any accountability of whether or not that patient or that employee is using that gym membership, where a wearable actually does track what their daily activity is. I think to gamify it, make it even more fun, and provide prizes or incentives for certain activity levels, I think is the next phase. Right? We were looking at some technology that would monitor warehouse workers basically doing some calisthenics or warming up prior to working their shift. And if they went through those correct stretches and warm up routine, that they could earn points that could be then turned in for electronics, like AirPods or something like that would be an incentive, or even just could be exchanged for additional cash, some sort of a wellness bonus.
Mm-hmm. These health tracking apps are on the rise these days. People are using it. Like, for example, there are various step trackers, then calorie counters and things like that, right? So people are getting more conscious about their well-being these days, especially after the pandemic, I believe.
I believe so, and it's also very interesting that a good majority of individuals now are not looking for that that quick solution, that quick fix. Maybe it's that there's a little more distrust in big pharma, not really looking out for their best interest. And so, patients have really made a shift to looking at alternatives. What should they be doing instead of just relying on a pill to resolve their situation. We, through marketing and all kinds of expensive ad campaigns, big pharma did a really good job to really create this microwave society. People always wanting instant gratification. We want everything immediate. So if you have an ache or pain, oh, there's a pill for that. If you have an allergy, oh, there's a pill for that. If you have anything going on, oh, there's a prescription medicine for that. Well, I think patients have kind of had an awakening and now understand, hey, that may not be in my best interest, or they recognize all of the major side effects that are coming from the different medications. We had a patient, one of our PharmDs that specializes in deprescribing, taking patients off of medications that are doing more harm than good. One patient had over 28 medications that they were on. And it's pretty interesting. The first, one or two medications may actually be treating a symptom, but medication 3, 4, and 5 are now medications prescribed to counteract the negative side effects of medication 1, 2, and 3. So it just creates this daisy chain of events that the more medications a patient is on, they need other medications to counteract the negative side effects of those first medications.
Mm-hmm. And can you explain the concept of telemedicine and how it is contributing to preventive healthcare and cost savings?
Yeah, so telemedicine or virtual medicine is a really good solution, right? Because the cost can be the cost savings there can be as much as 40 to 50% less than in-person visit. And that actually goes very well hand in hand with the health hub solutions where, community pharmacies can become their community's central location for healthcare, because it's very easy to put in, a telehealth station or virtual care solutions right there at the community pharmacy. And again, it's been shown that the cost savings are almost half of what it is, and more available. Patients waiting to see a PCP or a primary care provider, it may take weeks or a month to get to see a doctor, but a telehealth solution can be, same day.
And are there specific examples of successful preventive healthcare programs or initiatives that have led to significant cost reductions for individuals or healthcare systems?
Yeah, I would think any of the activity, that we're getting individuals up and moving and identifying, markers, blood markers that would show, or even family history that would show somebody is, more susceptible to getting, having either a heart disease or having diabetes. And so there are a lot of preventative measures that can be taken today in order to not have those issues down the road. Proper nutrition, number one, proper exercise, and even in our senior population, they don't necessarily need to become gym rats, right? And go be at the gym every day, but just simply getting up and moving, moving around and working on their mobility, practicing getting up off of the floor, and getting up and out of a chair, and if they feel like they're starting to have weakness in doing daily activities, certain things that they used to do, even in stability or fall prevention, then they need to work on those areas to strengthen, those muscles and prevent those future falls that may occur. And
what challenges and barriers can exist in this adoption of preventive medicine practices, and how can they be addressed?
Yeah, I think the number one challenge is what I believe we are finally overcoming, and that was that we had this instant gratification society that just wanted to be able to pop a pill and have any ache or pain go away, and now we have more of an enlightenment now where people realize, hey, that may not be the very best thing for me. Maybe I should look at minimizing inflammation in more natural ways. Maybe I need to consume more antioxidants so that I have less inflammation and less free radicals. There's amazing, technology coming out now with bioelectronics that helps to reduce inflammation or to, help in areas where someone may feel stiffness or pain in not having to take a medication, but to use bioelectronics to melt that pain away would certainly be a lot more healthy than taking a synthetic chemical that is just blocking the pain and not actually doing anything to eliminate that inflammation.
And what are the roles of patient education and lifestyle interventions in preventing chronic diseases and reducing healthcare expenditures?
Yeah, I think it's the more right? You can't just rely on what you may currently know today, but do a little more research, dive into it, and learn more on what can be done. I think we may be missing, as a general population, we may be missing the opportunity to really understand nutrition better and to take a conscious effort in eating healthier, eating more natural, less processed foods, and more, more fruits and vegetables and things that are not, already processed and prepared for us. So I think there's a huge opportunity to eliminate a lot of disease, just in understanding inflammation. Out of the 45,000 diseases that we know of, over 90%, it's like 93% of those diseases originate from inflammation. So if you understand, needing to reduce that and to minimize the amount of toxins and free radicals that you take into your system, and counteract that with antioxidants and in good healthy eating habits, will go a really long way for patients once they understand that.
Mm-hmm. Okay, so thank you, Breck. With this, we almost come to the end of today's session. Thank you so much for sharing your insights with us. And so last but not the least, would you like to share some more suggestions with our listeners?
Yeah, I think that there are some really good resources, as you say, what can patients do to be more educated. One resource that I would really love to, to point individuals to is on, there's a Facebook group called Healthcare Disruptors. It's also their YouTube healthcare_disruptors, is some really good information about how, patients can look at and learn more about the benefits of just healthy living. A really good group of both your traditional medical providers as well as more holistic or functional providers that participate in the Facebook group Healthcare Disruptors.
Thank you so much, Breck, for giving us your valuable time today. I hope you had a good session with me, because the session was very insightful for me and I did not know most of the things about this topic. So thank you so much again.
Yeah, thank you. This has been a lot of fun. I appreciate you taking the time to interview me.
Thank you again. So have a great day ahead. Bye-bye.
Thank you. Bye now.
Thanks for listening to Vantage Fit Corporate Wellness Podcast. Please do subscribe to Vantage Fit Corporate Wellness Podcast on Apple Podcast, Spotify, and our YouTube channel for new episodes.